10 questions about dick.
All right. My specialty.
What are the main causes for coming too soon?
That's an interesting question. Ejaculatory disorders are some of the most common sexual problems that we see.
Whoa. So that's when you like go, huh, 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 and then it goes, psh. Hello, my loves, and welcome back to Luvbites by Dr. Tara podcast, where we talk about sex, dating, love, relationships, you know, all that jazz. I hope you've had a great weekend, and I hope you've missed me. And also, our resident dick doctor is back.
I'm back.
Dr. Josh, I love that you did this. I'm back.
Yeah.
As in like you just
Exploded.
Exploded. A load.
Exactly.
Big one. But Dr. Josh is a board certified urologist. He has a practice here in West Hollywood, and I love calling him the Hollywood dick doctor.
I love you calling me that too.
Yes, I tell everybody that this is the Hollywood dick doctor. He came as a guest on Love Line, and we were like, he's the Hollywood dick doctor. And I'm just so grateful because you're also our resident dick doctor here on Luvbites.
Yeah. I love coming here.
More dick questions for you today.
Yes.
You excited?
I'm so excited.
10 questions about dick.
All right. My specialty.
Particularly how to last longer.
Oh, okay.
Yeah. How to last longer is my top 3 questions that I get in DMs from my followers.
Yeah. I mean, well, ejaculatory disorders are some of the most common sexual problems that we see.
I love that you use an academic term. Ejaculatory disorders. Oh, this is like erotica.
It sounds sexy, right?
Yeah. Okay, so number 1, what are the main causes for coming too soon?
That's an interesting question because we don't understand a lot about premature ejaculation.
Ooh.
So it's not fully understood why people have it. But the things that I see commonly are guys can have sort of like a hypertonic or spastic pelvic floor.
Where your pelvic goes like that?
Exactly. Yeah. They get stimulated, and what would otherwise be like normal stimuli to a person with normal ejaculatory time, sort of they're hypersensitive to it.
Oh.
And so their muscles start to spasm and they can't control it, and then they come too quickly.
Whoa. So that's when you like go, huh, 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 and then it goes, psh, psh, and then it goes, psh.
Exactly. I mean, I think most guys have experienced.
Sounds like I teach like kids. It goes, ha, ha, and then psh.
Yeah, exactly. Boom. I think most guys have experienced that where you get to that point where you like feel like you're going to ejaculate, but then can like stop a little bit. Guys who have premature ejaculation, a lot of times when they get to that point, they just, no matter what they do, they just can't stop, and they end up ejaculating before they want to. So there's definitely a pelvic floor component. There's certainly a brain component, especially in patients who have lifelong premature ejaculation, because there's 2 sort of types of premature ejaculation. There's people that are kind of born with it, and then others that acquire it at some point in their life.
I did not know people were born this way.
Oh, yeah.
There's some people that were born to have premature ejaculation.
Yeah. So there are guys that when you talk to them, ask them how long this has been going on, a lot of them will say like, well, as long as I can remember. And then you ask more specifically, well, do you remember even before you were having sex with partners, like when you first started masturbating, do you remember like it happening really quickly? And a lot of times, they'll say yes. And so it's something in their brain that is sort of hypersensitive to genital stimulation, that, a lot of times we have to put them on medications to kind of help with that problem.
Wow.
Yeah, I know. It's
my mind is blown. I thought all premature ejaculation was environment and like temporary.
No. Yeah. And so there's a lot of misconceptions, right? So there's that one that sort of, it's something that happens because of situational factors or environmental factors. But would you say
for most people it is temporary?
It is more commonly acquired than congenital. Congenital meaning like you're born with it.
Yeah.
But another big misconception is that it's a problem that only happens to young men. And that is actually not true. So we see premature ejaculation kind of consistently throughout someone's life. So you can be 50 and suddenly develop it. You can be a 25-year-old guy. So it can really happen at any point in your life.
Anyone can have PE.
Mm-hmm. Yeah. And sometimes, in those acquired situations, it can be a situational problem, right? Maybe it's a new partner, somebody that's like maybe been non-sexual for a really long time and suddenly starts engaging in sexual activity with a partner, and they're nervous. And so those sorts of things are I think a little bit easier to work through. I think it's the guys that have the congenital form or the type that's been going on for years and years and years that can be kind of more challenging.
Is it genetic?
We don't know.
Okay.
is the answer.
But some people are born and they just have had premature ejaculation and they will have throughout their lifetime.
It's hard to understand how much of it is genetic also because it's not like guys are talking to their dads about like, right? Like,
Dad,
oh, did you come really early?
Really fast?
Yeah. Or like, hey, mom, does dad come really quickly? Like, it's not like a conversation that
Go
gets
ask your
asked
parents.
a lot of. Yeah, exactly. Exactly.
So there's causes, there's pelvic floor stuff. There's whether
I would just say like brain stuff, right?
stuff.
Like hypersensitive brains.
Okay. Are there other things that cause it?
I guess there's some medications that can sometimes influence or shorten ejaculatory time.
Really?
But usually it's the opposite. Usually
Like
we
what,
have
a Zyrtec?
No, I was thinking more like we have medications, or people can be on medications that make it harder to come. I'm not that familiar with medications that make you come more quickly. I suppose some stimulant medications could cause that, ADHD medications and stuff like that.
Yeah.
Those medicines can sometimes make it harder to get an erection for some guys. And I suppose theoretically could make you come quicker than you want to. But I don't know that there's a lot of like evidence of that.
A couple of my students in college told me that they're taking SSRI and they feel like it affects their dicks.
Yeah. So SSRIs are notorious for causing a number of sexual health issues, including, I would say the biggest ones are delayed ejaculation.
Yeah, they can't come.
Interestingly enough, we use SSRIs off-label to treat premature ejaculation.
Oh, interesting.
So especially in the guys that are born with it, we one of the go-to medications that we use is Paxil, which is an SSRI that delays ejaculation. And when you're someone who comes too quickly, delayed ejaculation is actually great, right?
Yeah.
It's a side effect that we use to our advantage.
Interesting.
Yeah.
But these are the people that were born with it,
I mean,
have
we
a brain
sometimes
thing.
will use it in patients with acquired premature ejaculation, especially if it's like been going on for a long time and it's happening, when they masturbate and when they have partnered sex. Like, I'll still talk to them about the potential benefit. You have to be a little bit careful because sometimes one of the other side effects of SSRIs is that it can lower libido. And so I always warn patients that it might affect their sexual desire. But, if you're somebody who's coming within like 30 seconds, a lot of times if they see a little bit dip in their libido, it's worth it for them because they can still have sex and last longer and it's more enjoyable for them.
30 seconds is fast. So my probing question is like, what is coming too fast?
So the textbook definition of premature ejaculation is within 1 minute.
Okay. That's pretty fast.
Vaginal penetration.
Yeah.
So it's pretty specific in terms of how we define it. Now,
what about anal penetration?
Good question. So in my practice, I sort of modify that textbook definition because that definition doesn't apply to a lot of people and a lot of types of sexual activity. But it's, historically been based on like a penovaginal model, right?
Yeah.
So I always,
You mean the way God intended?
Exactly. Straight sex. So I always talk to my patients about what types of activity they're engaging in because some guys come within a minute of receiving oral sex, right?
Which is great.
Yeah.
Because like my mouth is tired. The faster you can come, the better. Like, when
you don't got 2-3 minutes in you?
No, when I give a blowjob, I want them to have premature ejaculation.
All right.
I want it to be like bam. That gives me higher self-esteem.
I love that.
Like, wow,
I love that.
how good was my mouth?
I know. You're doing a great job if that's the case.
Maybe I should quit my vaginal penetration forever because my mouth is so good. But
I always tell my patients, like, it's within a minute of any type of activity that you normally engage in that is frustrating to you, right? So if it's like you're having anal sex and you come too quickly, you're having vaginal sex, you're receiving oral sex, or listen, even if you're masturbating, right? If you're masturbating and you're ejaculating within 30 seconds and it's like a frustrating experience for you.
Is it?
I mean, sometimes I want to come in 30 seconds. Other times I want to enjoy, take a little time, and see how things develop. You know what I mean? So
see how things, see if my penis develops differently.
Yeah. Exactly. So I think, we always, when we're treating sexual dysfunction, right, it's like, is the person meeting the criteria that defines that sexual dysfunction? And also, is it causing distress, like to the person, the individual, or a problem in their relationship?
That's like the main thing, right? It has to be like frustrating.
Exactly. Right. Like if you come within 30 seconds and it's like,
you don't care.
You're a busy person and that's great for you and it's not affecting you and your partner, then we don't have to do anything about it, you know?
Right.
But it's usually something that actually really bothers guys.
Yeah.
And they usually come to see me because it's screwed up their relationships, right? Like partners take it really personally, or sometimes it affects fertility, right? Like if they're coming before they can even penetrate, right, then they can't deposit that sperm where it needs to go, and it makes it harder to get pregnant. So like
a real technical problem.
Yeah. So like female partners will sometimes get frustrated, and then guys get frustrated, and it breaks up relationships, and then, you know, they seek help.
Look at you. Saving marriages and relationships and families.
Yeah.
Saving families.
Yeah. Doing God's work. Yeah.
When you say like, if it doesn't bother you, then it's fine. But is there like, I guess, a textbook medical reason why coming too soon is bad, and like it's related to other health issues, or no?
So it has not been linked to specific other health issues. It's interesting that you brought up like, why do we think, right? Like I started out by saying we don't fully understand why men have premature ejaculation. There is this theory that it is sort of an evolutionary thing that we have developed as men, specifically like if you're a man who has erectile dysfunction, right? There's a large correlation between ED and premature ejaculation. And we think it's because like if you were like a caveman back in prehistoric times, right? Whatever, that if you couldn't get hard or stay hard, the way that you could guarantee that you could reproduce is that you come quickly, right? So like if you like grab your cave woman and you just, you know, if
deposit that
exactly
semen.
like come really quickly to like make children, you know what I mean? So there's some evolutionary biology that probably plays a role there, but again, there's a lot that we don't know.
How can someone train themselves to last longer?
So there's lots of different ways. So there's behavioral techniques that they can try. There's not a ton of evidence that they make a big difference, especially if someone has dealt with this their whole life, because again, that's probably more like a brain issue.
It's not like if you start like running at the gym, you'll last longer.
Right. So I mentioned the importance of the pelvic floor. So there have been studies published showing improvements in ejaculatory control with pelvic floor physical therapy. So I refer a lot of patients with PE to physical therapists. So that's one thing that can be really helpful. There's things like the start-stop technique, right, where you're having sex, and then when you get to that point that I mentioned where you feel like you're going to ejaculate, you just sort of stop everything that you're doing. That's really difficult to do if you've ever had sex with another person, like to just be like, nope, all right, we're stopping everything, right? It's frustrating for the person. It's frustrating for the partner.
And that's edging.
It's a little different than edging.
Okay.
Edging is sort of like voluntarily and intentionally kind of squeezing the pelvic muscles. The start-stop technique is literally like if you're masturbating and you get to that point, you just stop touching yourself. Or if you're having sex and you're penetrating your partner and you feel like you're about to come, you just stop or pull out really quickly and stop everything.
Wow.
But
that is so confusing for the partner.
Exactly.
Especially if it wasn't communicated before.
Exactly. And there's a lot of shame that guys experience with premature ejaculation. So a lot of times they're not necessarily telling their partners. So I think for those reasons, some of these behavioral techniques are not that successful. But there's other stuff that I will often recommend to patients, like, you know, talking to or working with a sex therapist to talk about what's going on in their head while they're having sex. Are they distracted, or should we work on ways to distract themselves so that they're not hyper-focused on what's happening? There's other things like using toy sleeves, things like the Fleshlight, you know, those sorts of things that are like you can train yourself to masturbate in a certain way and gain control slowly over time. So like using certain toys can be helpful also.
Awesome. Are there certain sex positions that are better for stamina and to last longer?
Not really, because it just depends on what is stimulating to your penis, right? As an individual. So like if there are certain positions that are more stimulating, then you'll probably want to avoid those or do those last, right? Because they're going to make it more likely that you come too quickly. But there's not like, oh, you know, doggy style is better for like control for everybody. You know what I mean? It's just dependent on the individual.
Wow.
Yeah.
Now, for the start-stop technique that you talked about, you said it is not the same as edging.
Right.
So for edging, it's like you're masturbating until a certain point and you feel very aroused, and then you're sort of like contract.
Yeah, so
your-
it's a contraction of your pelvic floor muscles.
But you also stop like stroking yourself.
Yes, yeah. You just have to be a little bit careful with edging. It is something that can, when done correctly, can prolong the sexual experience and can be a good thing.
But there is a danger to edging.
There is a danger. I saw someone last week who edged for like 8 hours
Whoa.
a day for like several days in a row, who ended up coming into me like in tears. He was like 25 years old, because after he did this like practice, and he also was like, I think I'm, abusing porn. I'm watching it too much, and I'm depressed, and I was sitting at home just masturbating and edging all day, where he stopped getting spontaneous erections. And then when he was trying to masturbate, he like couldn't get hard, and he freaked out, right? He like came in crying and was like super worried that he'd harmed himself. Turns out like he probably just put too much strain on his pelvic floor, and he probably just needs to work with a pelvic floor physical therapist. Like, I don't think he caused permanent damage, but I've seen patients develop, erectile dysfunction from edging, pain. Sometimes if the muscles are too tight when they do ejaculate, they start having pain, pain with erection. So it's something that you just have to be careful about.
And how can you be careful?
So I wouldn't do it for 8 hours.
Right. I've never heard that before. People usually just do it for like 30 minutes.
Yeah. I mean, I think for some people can be a compulsion, right? Like they think, I if I can like edge like as long as possible, that it'll make my final orgasm that much better.
Or maybe he was also listening or watching to one of these like bros.
Yeah, like the semen
bros.
retention thing. Yeah. So I think there's a lot of like misinformation and just sort of misconceptions about like the benefits of edging and like how long you should be doing it. I think if you're doing it, especially like with a partner, to like prolong the time that you are intimate and having sex with your partner, it can be a really positive thing. But like if you're sitting at home alone, depressed on your computer, compulsively using porn and edging for hours at a time, that's probably not going to be a healthy practice.
So be more mindful.
Yeah. And I would say like
yourself.
Exactly. Like don't go hours and hours where you're trying to edge, because that's when it can kind of tip over into being problematic, I think.
Can we sidetrack a little bit on semen retention? Because you mentioned that, and like I just, because of what I do on social media, I get many of these bros want to come on the podcast.
Yeah.
And I'm like, I'm not sure. You're a guru, you practice in Tulum. Like, I don't know. Can you talk a little bit about that? Because there's a lot of young men watching my show, and I think they have a lot of false information. Yeah.
I mean, I think there is a lot of misinformation about semen retention and its health benefits, right? And I think some of it's actually, my understanding is that it sort of comes from like Eastern medicine influence, right? Like this sort of keeping your chi, right? Like energy, holding onto your energy, right? But people extrapolate that like and say that like not coming for like weeks at a time.
Years.
Yeah, exactly. Makes you more powerful, stronger, more attractive. Like, all of these like bizarre beliefs that are not based in any kind of science at all. And there's not any health benefits that have ever been shown to semen retention, but there have been health benefits to ejaculating more that have been shown, right? It's good for your mental health. It reduces stress. It helps improve your mood.
Coming is good for you.
It reduces anxiety. There was a study that showed that guys that ejaculated more than 20 times in a month were at reduced risk of prostate cancer. So there's like real health benefits to coming, and none that have really been shown for not coming. So
no like scientific peer review study about semen retention?
No. So it's just, I mean, if that's something that is important to you and you find personally some benefit to, all power to you.
Like
right?
a placebo.
Yeah, like all power to you.
Yeah.
Is there any evidence to suggest that is true for everyone? No. And, I think if people came more, there would probably be a lot more happy people in the world 100%. And a lot less, violence.
Yeah.
So I always try to encourage patients to come more.
I saw on Reddit. I love Reddit, but I also hate Reddit.
Yeah, it can be a scary place.
It depends. Like if I'm up at 2 a.m., I don't want to look at Instagram. It's too stimulating. I just read stuff on Reddit.
Yeah.
And sometimes I'll run into boards that talk about like things like that. And there was this guy in one post that said he had been like not coming for 6 months. And he said he feels almost like, but he's not sure if it's true, but he feels almost like his penis and his balls like hurt. Is there any sort of potential truth to that? Or is this person just like BSing?
It's hard to say. I don't know without knowing what's going on with this individual.
Just like, does it hurt to not come at all for 6 months?
Blue balls are essentially like, that's that same feeling, right? Like there's like, you're getting stimulated. Cause I'm sure he's not just like sitting around not doing anything.
Blue balls
he's
real?
Probably like still stimulating himself, but just not letting himself come, right? So, it's not like most of these people, I mean, there's the other thing that we can talk about if you want, the no FAP stuff, which is like no masturbation at all. But a lot of the semen retention guys are not necessarily avoiding masturbation. They're just not coming from masturbation. So again, like what are they doing when they're masturbating? They're probably edging, right? They're probably tightening. If you're doing that for 6 months, stuff down there may start to hurt.
Tight?
Yeah.
Blue balls.
Exactly.
Is it real?
Yeah. It's
Is it actually blue?
Well, so they're called blue balls because of some backflow of blood that can happen in the veins. But we really think that the sensation of blue balls, the achy sensation, the pain that people experience is probably more related to tension that builds up in the pelvic floor.
Last thing about semen retention, and then we'll move on to how to last longer. People say if you do semen retention, you come a bigger load. It
depends. I mean, you can. So let's say you don't come for 3 days, right? Like usually your loads are bigger.
Yeah, but people who do semen retention, it's not 3 days.
Exactly.
It's like months.
I mean, the guy that retained for 6 months, he's not going to shoot like gallons, right? Like at your
he's
prostate.
Not just storing them in his
No, because the fluid that your prostate is making, if you're not ejaculating it, it's going to absorb that fluid, right? So there is some truth to like abstaining from ejaculation for a couple of days at a time, or like for guys who are trying to get their partners pregnant, right? We usually tell them like they should be waiting a certain number of days before ejaculating during ovulation to try to increase their chances. But no, I don't. They're not going to.
A couple of days, not
exactly.
Months.
Right. Yeah.
Interesting. But you know what? There's something that can increase the semen load size.
There is. I'm very familiar with it.
Have you ever heard of POPSTAR?
Once or twice. Yeah.
POPSTAR is my favorite brand, and especially this one is POPSTAR Volume Plus Taste Enhancer. It was created by 2 board-certified urologists. One of them is sitting right here. The other one, Dr. Brian, who's in the East Coast, right?
Yeah. Yeah, he's in Jersey.
But POPSTAR, like my husband takes it. And he shoots big loads.
Yeah.
Which is very hot, by the way. So POPSTAR has Volume Plus Taste Enhancer. There's also the fertility one.
Yes.
For men that are like trying. But this one, when you take it regularly, not only that you will increase your load size, your load will also be tastier.
Yeah.
And a tastier load is better for things like oral sex, right? Like if you're having sex with a partner and your partner is giving you oral and you want to come in their mouth, for example, it's always nice when it like doesn't taste gross.
Yeah.
And this helps with the taste.
Yeah. It sort of neutralizes and sort of sweetens the sort of natural bitter taste of semen.
Yeah.
And there's like a lot of things that influence, if someone smokes a lot or drinks a lot of alcohol or eats a lot of red meat, they can have funky tasting spunk, right? So this helps kind of neutralize that and make it more appetizing.
Appetizing. Who doesn't love tasty cum? It's like going, when you go get sushi, there's like that dish that's kind of like a creamy white sushi. I always thought of POPSTAR. Like, ooh, is this whale sperm? That's what it is.
Yeah.
Like the whale was taking POPSTAR because it was tasty. So definitely check out POPSTAR Volume Plus Taste Enhancer. The link is in the episode description. But POPSTAR also came out with my new favorite lubes, Play. There's a silicone-based one, and a water-based one. The silicone-based one lasts longer. Like it's slippery longer.
Yeah.
But the water-based one is for people who are very sensitive or people that are allergic to silicone.
Yeah. And I also tell people like with the silicone is good for shower play.
Oh, yeah.
Yeah. You have to be careful with silicone because it can stain sheets and that kind of stuff. But
that's right.
It is slipperier, it lasts longer, good for showers, good for anal.
Good for anal. Very good for anal. I have tried.
Yeah. But yeah, we wanted to have both so that, like you said, people that are sensitive to silicone.
Yeah, there are some people that swear by water-based ones.
Yeah.
Like they don't use silicone ever.
Yeah.
Even when they're not allergic.
Yeah.
Yeah.
Yeah, I'm a silicone girl myself.
I'm a silicone girl too.
But yeah, water works for certain people better.
Yeah, for sure. I love it. So if you're looking for new lubes, which you should be looking for new lubes and using lube, by the way,
yes,
whatever type of sex you're having, or even when you're masturbating, like. When you masturbate, for the men listening, like consider using lube when you masturbate.
Yeah,
it changes the sensation than dry hands. And I mean, you can quit from like, using Vaseline or
yeah.
Because that's so like middle school, right? Like I know a lot of middle school boys will start trying to like use lotion.
Yep.
Because like they can't buy lube.
Right.
But if you're listening means you're over 18, definitely check out Lube Play from POPSTAR. The link is in the episode description. So next, I want to ask about potential help for coming too soon or premature ejaculation that's in forms of like food or supplements. Are there anything at all that can help people like that consume them last longer?
So I am not aware. First of all, dietary wise, no. There's nothing that's been shown to help improve ejaculatory control. I've seen that there's like some supplements out there. There's nothing that's ever really been studied well that has been proven to help men have better
gas
control.
Station pills.
Yeah. I mean, most of those are about getting better erections, but those can be risky to take anyway. But no, if someone came to me and said, like, what can I do that's natural to help with this problem? I would probably give them some of the behavioral stuff that we talked about, using certain types of sex toys. There's numbing sprays that people can use. There's not any like food recommendations or supplements that I would specifically recommend.
Does clearing the pipe before sex help you last longer? So you masturbate.
That is one strategy that we tell patients, because a lot of guys with premature ejaculation have better control the second time, right? So if I ask them that and they say, yeah, usually when I try to have sex again, I can last, 5 minutes or last longer, then sometimes, especially if they're like newly dating someone, right? And they may not feel comfortable telling this person that they have this problem. Sometimes I'll just say like, why don't you just, jerk off before the date, right? And that's like one strategy to help them have
jerk off before the date.
Yeah. Just go into the bathroom and do it real quick. But that's one
at the date.
Exactly. That did at the restaurant. Just I'll be right back. But yeah, that's one way that guys can have better control, is to just ejaculate quickly one time and then try to have sex again.
Okay. So it does help some people.
Yeah.
But it's not like a guarantee.
Not necessarily.
So you could also come really
fast. The other
fast
problem is
time.
like depending on the person and what their erectile function is, sometimes they can't have sex again. You know what I mean? Sometimes they might have trouble getting hard again. But if it's a young guy, like
after masturbating?
Yeah. I mean, like younger guys usually like are ready to go pretty quickly after they come.
Yeah.
So that's a good strategy for younger men. If it's an older guy, who may be already struggling with ED, that might be a little hard for them to do, because if they ejaculate with masturbation that first time, they may have trouble getting hard for the second time.
It's like, it's over. It's done.
Exactly.
I can come one time a day.
Yeah.
I have seen a number of products in the market.
Yeah.
Creams, sprays. Can you talk a little bit more about that?
Yeah, so they're usually all numbing options, right? So there's sprays, there's creams, there's wipes even. They're usually all have some sort of numbing product in them, most often lidocaine.
What my dentist uses.
Exactly. Yeah. So yeah, when your dentist injects your, gums or your
it's
tooth.
lidocaine.
That's right. Yeah. So it's a numbing agent that usually gets put onto the penis before sex. And what it does is it essentially desensitizes your penis so that you aren't as sensitive and then therefore have better control. Yeah.
Are you planning to have one coming out?
We are. Yeah. So
because I figured like you have dick related products.
Yeah, we're sort of like building POPSTAR out. I mean, it started out with just volume and taste, and then we were getting asked about a lot of different sexual health issues and whether we had solutions for those. And so Brian and I have slowly developed a product line to try to help everyone have better orgasms, right? So what does that mean? That means more volume, better taste. That means slippery sex. So sex feels better. And then we are, very soon going to launch a delay spray to help guys have better control so that when they do have that orgasm, it's a more pleasurable experience.
Is it safe for the vagina?
It is, yeah. So our product is going to have like an anti-transfer technology. So you spray it directly on the penis, usually a few sprays, a few minutes before sex. And then some of the older products that I used to recommend to my patients, I would usually tell them to use in conjunction with a condom so that it didn't transfer to a partner. But this, our product's going to have this new technology where that's not an issue. It dries very quickly, it gets absorbed, and patients can just insert it and not worry about transferring it to their partner.
Does it have a smell?
No.
Really?
Yeah.
No smell?
No. Do you want it to smell?
No.
Okay.
I got sent a couple and they usually smell.
Like?
Just medical. Like smell,
like
I don't know, smell like the hospital.
Something?
Yeah.
Oh.
Which is not very sexy. Yeah. Well, unless you have like doctor, nurse, role play fantasy, then yes. But like, yeah, it smells a little bit too like medical.
Huh. Interesting. Yeah, no.
I'm excited to try.
Yeah, me too.
Well, not me. I don't have a penis. I wish I had a penis.
You might spray it on your husband and he'll be like, why'd you do that?
Yeah. Now he'll last forever.
Exactly.
Jeez. Not when I have to give a blowjob. That I want 10 seconds. How does stress or anxiety affect premature ejaculation?
I mean, it can definitely play a role. So a lot of times when guys are nervous or anxious, again, it's both a combination of what's going on in their brain, but also how that anxiety and stress is triggering their pelvic floor that makes it so that they kind of lose control and ejaculate too quickly. So, if they are stressed, it's sort of a vicious cycle, right? Like if you have this problem, it makes people anxious, then that makes their problem worse. Oh. So a lot of times what my job is to give them strategies, whether that be numbing sprays or behavioral techniques or medication to help them last longer so that they become less anxious about sex. And then, if they are able to perform normally for a period of time, then sometimes we'll say, let's take a break from that numbing spray. Let's take a break from that medication and see if their ejaculation time is more normal.
Oh, something just came to my mind. I also saw on Reddit. Is this true? Like men that take a lot of hot baths tend to have erectile dysfunction, more likely to have erectile dysfunction? Not
that I'm aware of.
Okay.
You can definitely cause issues with fertility if you take
not having a lot of sperm.
Yeah. So like hot baths, hot tubs, saunas.
Which is so popular now.
Yeah. People that engage in those activities a lot who are trying to have a kid. We usually tell them to cut it out at least for that period of time so that they can, because when the testicles get too hot, they're not able to produce sperm in it.
But it produces so often, right? Like if you quit baths or saunas for like a week, then you're like back to normal. Yeah,
but then if you re-engage in that, it's so typically what we tell people is just to stop those activities until they get pregnant. Yeah. And then they can resume the activities. But
so all the dudes out there that go to the sauna every day, do they just not have sperm?
No, they're still producing sperm, and there's nothing inherently wrong with those activities, right?
Okay.
Like a lot of people.
Yeah, because it's great for you, right?
Yeah, like people find it's good for your skin. It helps like kind of detoxify.
Yeah.
We only tell people to avoid them when they're trying to get pregnant and having trouble, right? So like if you're able to get someone pregnant and you're going to a sauna every day, more power to you. Like continue to do those activities. It's just like when I see men who are like, my partner and I have been trying for 6 months, a year, and then you talk to them about like what behaviors they're engaging in, right? Like if they're drinking a lot, if they're smoking, like we say, okay, you got to cut back on those things. And then I always ask about hot tub saunas and that kind of stuff. They're doing those kinds of activities. And I'm like, hey, well, while we're cutting out these other things, you should also try to cut back on that stuff.
Because Japanese men in Japan like love onsen, like the hot baths. Yeah. And Japan also has really low birth rate. Is there like a potential correlation to that?
Yeah. I never thought about that.
I know. I was like, but then in Finland, and they go to saunas every day in Finland. They have saunas at home.
Yeah.
They don't have fertility problem. So I'm like,
They just have better sperm.
Interesting. Yeah. Who knows?
Yeah.
Who knows? Next question is about the desensitizing condoms. Are they effective or they just ruin the mood?
I don't have any personal familiarity with those, so I don't know. I think it probably just depends on the individual. I think,
But is it just lidocaine in it?
usually,
Yeah. Okay.
yeah. So it's just, I mean, condoms already alone can be a strategy for some guys with premature ejaculation to desensitize them, right? Like it's a barrier. So that can be helpful for guys with premature ejaculation issues. But some guys with really bad PE, even a condom isn't enough. That's why sometimes they'll use these desensitizing condoms, because it has, on top of the barrier, also adding an anesthetic.
What do you think is like the type of stimulation that perhaps cause the most premature ejaculation, like anal, oral, vaginal, like hand job?
Yeah, I would say probably the most well understood and well studied is certainly vaginal sex.
Okay.
And that's usually what brings people in, is that they, like, as they're getting ready to insert their penis into their partner's vagina, they come too quickly. But I mean, I have a lot of gay patients, so they tell me all the time the same thing can happen when they're trying to top somebody,
Yeah.
But I think just in terms of like medicine, it's mostly been focused on penis vagina sex. So we see that more.
What's the role of testosterone in premature ejaculation, if any?
I think there's been a couple studies that have shown that guys with premature ejaculation are more likely to have, there's a correlation with low testosterone, but it's not like putting someone on testosterone or putting them on a treatment to increase their testosterone is going to fix everybody's premature ejaculation. So, in general, when I see patients with any sexual health issue, it's a very easy thing to kind of screen them for low T. And a lot of times premature ejaculation can exist with other problems, like I mentioned earlier, erectile dysfunction, which can be very influenced by testosterone and your hormone health. So I screen almost everybody for testosterone issues and other hormonal issues, no matter what they're coming in for. And there is a correlation there, but it's not necessarily causation, right? It doesn't mean that if you have premature ejaculation, your T is definitely low.
Right.
And it doesn't mean that if you have premature ejaculation, if going on testosterone is going to fix the problem.
Sometimes it happens together, but it's not the cause of it.
That's right.
Okay. What are some things you want people to know regarding men's sexual health and also lasting longer?
I think there's a big misconception about what is normal. So you asked me about like the textbook definition. So as we talked about, like it's within 1 minute, right? A lot of people think that if they, I have had guys come in and think that they have premature ejaculation. And when I talk to them, ask them like how long they last, they're like, well, I usually go like 8-9 minutes and then I come, and it's so frustrating. And I like have to like sort of tell them that that's actually quite normal.
Yeah.
Doesn't mean that we can't talk about techniques to help them last longer beyond that, but technically they don't have premature ejaculation. So that's one thing, is just educating people on what a normal time to ejaculation is, which is about 5 to 7 minutes, right?
Yeah, my favorite is like 2 to 3 songs.
Yeah.
Because that's how I don't know how many
Do you have
minutes.
like a sex playlist?
Yes.
Yeah, I love
and
that.
if we're playing music, I know kind of like from the start, because I notice the song.
Yeah.
I'm not paying attention to the song, but
Yeah.
I notice it.
Yeah.
And I notice that it's like, oh, it's been like third song. Then I'm like, okay, we're good.
Yeah.
It's almost like I train myself to come, like, but I can usually orgasm vaginally faster if I already came clitorally. Which makes sense, right?
Yeah.
Like,
I mean, it depends on the individual, but yeah.
So if I use a vibrator during foreplay, when we're kissing and massaging and doing things, then when he penetrates and we have vaginal sex, I usually orgasm in like 3 to 5 minutes.
Yeah.
Which, after talking to all my friends, very normal.
Yeah.
And so when guys are like, I want to last 30 minutes, I'm like, for who?
Yeah.
Like for yourself? Or?
Exactly. I mean, if you and your partner find that pleasurable and have the time to do that, because God knows I don't have the time to do that, but
straight penetration for 30 minutes sounds like my vagina
first of all,
would
you better be
so
using
raw.
a lot of lube.
You better be using so much
because no
lube.
one naturally lubricates for that long.
No women will be wet after like 15 minutes.
Yeah. So again, if you're on vacation and you guys have all
long
day
session,
to just like
maybe
have
like
sex.
tantric.
Yeah, but like also sex isn't just the penetration, right? So like that clock, in my opinion, starts when you start fooling around, when you're kissing, when you're taking each other's clothes off, right?
Yes.
So like from that point until ejaculation, if you're making that whole process last an hour and 10 minutes of that is penetration, great.
Yes.
But if you want to just be like jackhammering for 30 minutes to an hour, you better have a really understanding partner who has a lot of time on their hand
Unacceptable.
and be using a lot of external lubricant.
No woman likes straight penetration for 30 minutes.
Yeah. Yeah. I would agree
hurts.
with that.
Yeah.
Yeah. And the other thing is like, just because you don't meet the criteria, right? Like if you're someone who ejaculates within 2 minutes, you technically don't meet the criteria for premature ejaculation. That doesn't mean that we can't help you with techniques, with medications, with sprays, to get you to be able to have better control so that sex is more pleasurable. It's all about sort of, what your goals are, as long as they're realistic goals, to get you to the point where you have better orgasms, to where you have better satisfying sex.
Love it. Where can everyone find you?
So I am on all the socials, primarily Instagram, TikTok at Joshua Gonzalez MD. Oh, YouTube also. And, POPSTAR is also pretty prolific on Instagram as well. So we're at POPSTAR Labs, where we just do funny posts and educate people about sex health topics.
Your socials are so fun.
Thank you. Yours are too. I mean, you're my hero.
Oh, thank you so much for hanging out with us and teach us all about how to last longer.
Yeah, anytime.
Thank you, my loves, for listening and watching till the end of the episode. Please like, subscribe, share, comment. We love them when we see them. And again, thanks for, spending the time just watching and listening till the end of the episode. I talk about this sometimes where people will watch a little bit at the beginning and then forget to watch the rest. But I think there's just so much information in each episode, like this one with Dr. Josh, where, you never know which part of the episode you'll really learn something that you need. So thank you for watching the whole episode. And per usual, have an orgasmic day. Bye.
Thanks for listening. This was Love Bites.
Love Bites.
By Dr. Tara. Follow Dr. Tara on social media at lovebites.co. Have an orgasmic day.